Well, good morning and welcome to Radio Doctor. Radio Doctor is your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on your women radio 91.7. Radio Doctor is broadcast from 10 a.m. Mondays through to Fridays. My name is Miracle Philip, and our Radio Doctor for today is Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. Good morning to you, Dr. Abiola. How are you today?
I'm doing great. Good morning, Miracle.
We're glad to have you join us today.
My pleasure.
On Radio Doctor today, Dr. Abiola Ajayi, MD and CEO of ROA Specialist Hospital, will be consulting and advising on the connection between physical and mental health, how mental health affects the body. So maybe you have always thought, I'm emotionally down, I'm mentally not okay, but it has nothing to do with my physicality. Well, we're about to debunk that thought that you've always had, so make sure that you listen through. The phone lines will always be on for you to get to call in and ask Dr. Abiola Ajayi whatever questions you have. They are 07000 917 917 or 9155 917 917. Our toll-free number for women 0800 1235 917, and we have our text and WhatsApp line 08155 917 917 0703 175 6537. Those are the lines for you to get to reach us on this morning, as Dr. Abiola will be speaking on the connection between physical and mental health, how mental health affects the body. So Dr. Abiola, let's delve in now. What happens in the body physically when a person experiences prolonged stress or anxiety?
I'll answer your question. I just want to say I appreciate you guys for even attempting this topic. Mental health in Nigeria is, we ignore it, or we even stigmatize it. You know, people are meant to be mentally strong. I know my dad, when I told my dad one time I was depressed, he said, "Men don't get depressed." That was back in the day, but and I'm sure there are a lot of people that can relate to that. So let's jump right in. You asked about what happens in the body physically. When we experience prolonged stress, your body enters a chronic state of alertness, like this, something called fight or flight, and we'll talk more about that later. But your brain tells your adrenal glands, that these little glands that sit on top of your kidney, to release cortisol and adrenaline, and those two hormones speed up your heart rate, they raise your blood pressure, they increase your blood sugar, and they tighten your muscles. All great things when you're trying to run away from a bear or a lion, but your body was never meant to stay in this fight or flight mode for long. So over time, this can lead to high blood pressure, heart disease, difficulty sleeping, insomnia, and even diabetes. In Nigeria, stress-related hypertension or high blood pressure is now one of the leading causes of people going to the hospital. And in the States, 75% of primary care visits, that's like going to a family practice doctor, 75% of those visits are stress-related. So this is not a small issue, it's a silent epidemic.
Well, it is really a silent epidemic, as you shared. And now I want us to delve into what a lot of people get to deal with, and what your father said, hey, men, do not get depressed. How does depression affect vital organs like the heart or the brain?
Yeah, no, good question. Depression doesn't just affect your mood. It actually alters your brain chemistry and increases inflammation throughout your body. So over time, this inflammation can damage your blood vessels. That damage in your blood vessels can lead to heart attacks and strokes. Depression also reduces blood flow to your brain, which shrinks a part of your brain called the hippocampus, which is responsible for memory. So somebody that's depressed or in depressed mood is going to have trouble retaining memory. There was a study shown that, I like statistics and I like studies, so I'm always going to put those stats in there. There's a study showing that people with depression are 60% more likely to develop heart disease. And I know in Nigeria, many patients are diagnosed with heart disease before anybody asks them about depression. So I honestly, every time if I see a patient coming with high blood pressure, chest pain, yes, I'm thinking about heart. I'm thinking about heart attack, heart disease. But I also ask about stress, lifestyle, and do you have depressed mood or depressed thoughts? It's extremely important. If you don't treat that, it's going to be difficult to treat the other problem.
Well, very, very important facts that you shared there. And, it just really tells a lot about the fact that people now need to be on the lookout. At any point where you feel like your emotions are unstable, you need to deal with the cause so it does not accumulate into something disastrous much later on. Dr. Abiola, can chronic mental stress lead to high blood pressure or irregular heartbeat? I think people call that palpitation. Please explain.
The simple answer is yes, and it's one of the most dangerous effects. Stress increases something called your sympathetic nervous system, which is responsible for the fight or flight syndrome. So stress will cause your blood pressure to go up, and it can sometimes trigger irregular heart rhythms, or and the person will feel it as palpitations. Doctors would call it atrial fibrillation or premature ventricular contractions. I actually suffer from the second one, so I understand it very well. The heart starts to beat harder and faster for no physical reason. So if you're running down the street, yeah, your heart's going to start beating faster to move blood. But with stress, you get that same effect with no physical reason. There was a study done at the University of Ibadan that said that linked chronic workplace stress to high blood pressure in 36% of cases, over a third percent of cases. So and it's the same in the U.S. About 1 in 3 adults with high blood pressure can say emotional strain is a contributor to their high blood pressure. So it's rather significant.
Well, thank you so much for expanding on this, Dr. Abiola. I know there's someone who might have this as a lingering question in their mind about how anxiety shows up with signs like tightness in their chest or shortness of breath. Why is this?
A good way to think about it is anxiety hijacks your nervous system. So your breathing becomes faster and shallow. Your chest muscles are going to tighten. And many people with anxiety think they're having a heart attack. And this is how mental distress can mimic a physical emergency.
Okay.
We regularly see panic attack cases come in and they present like heart attack cases. And so now you're going through, you're doing all your tests, and everything's coming back normal. And if you don't ask questions around anxiety, you could actually miss the true cause.
All right, thank you very much, Dr. Abiola. If you've just tuned in, this is 13 minutes past 10 on your Women Radio 91.7, Nigeria's first and only radio station for women and their families. And we have with us Dr. Abiola Ajayi, who is consulting and advising on the connection between physical and mental health, how mental health affects the body. Now, if you do have any questions you have for Dr. Abiola this morning, the phone lines are 07000 917 917 or 9155 917 917. Our toll-free number for women 0800 1235 917, and our text and WhatsApp line 08155 917 917 0703 175 6537. Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital, is consulting and advising on the connection between physical and mental health, how mental health affects the body. Now, Dr. Abiola, is there a scientific explanation for frequent headaches or migraines linked to mental stress?
Short answer is absolutely. when you undergo stress, it tightens the muscles around your head and your neck, and this leads to tension headaches. Tension headaches are a type of migraine. It also disrupts one of your hormones called serotonin in the brain, and that can also trigger migraines. In Nigeria, 30% of students and working class adults report recurrent headaches tied to emotional distress. So I like reinforcing those statistics. 30%. So this is a very prevalent issue, and it's good that we're addressing it. But absolutely, your muscles tighten, can lead to migraines, and then of course once you start having migraines and headaches, everything else gets where it's hard to work, hard to study, hard to even pay attention.
I would like to quickly ask, what exactly should anyone do when they experience this, for the first time?
Yeah, well, especially if they can identify maybe some stress that's causing it. There's so many different ways that you can help manage stress. The easiest one would be breathing exercises, and maybe later I'll talk more about that. But the easiest thing to do is take time out. You have this time out, move. Even if you're at work, move to another area, go outside, go to the restroom, something, and you want to breathe. And when I say breathe, people think that we're breathing all the time, aren't we? Yes, but this is a specific type of breathing. So you're taking a breath in and you're counting. So 1, 2, 3, 4 in, pause. 1, 2, 3, 4 out, pause. 1, 2, 3, 4 in, and do that trying to get to 10. You will be surprised by the time you get to 10 cycles, your stress level has dropped. This has been tested over and over again. Even your hormone levels, the stress hormone levels like cortisol and adrenaline, like we mentioned before, will go down just with the breathing. So once you identify it, you can start there. If you know how to do meditation, or which I do almost every day, if you know how to do yoga, any of these things can help alleviate stress.
All right, thank you very much, Dr. Abiola, for sharing this with us. Let's look at the long-term emotional stress. How can this weaken the immune system and make people prone to infections?
So you hear me talk about cortisol. Cortisol is the stress hormone, and cortisol actually suppresses your immune system. So when cortisol is elevated for long periods, it can suppress your immune cells, and this means that you're more likely to catch whatever infection is in the area. Stress also triggers inflammation, so it makes it harder to fight off bacteria. So a lot of people don't know, when you have an infection, it just means that the bacteria or the fungus or whatever has overwhelmed your immune system. Bacteria live on our skin. Bacteria are everywhere. Viruses too. And our immune system is constantly clearing them from the body. But whenever they get overwhelmed, especially during times of stress, then you now feel the results of an infection.
All right, thank you very much, Dr. Abiola. It's still Radio Dr. on your Women Radio 91.7, Nigeria's first and only radio station for women and their families. And we have with us Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital. He is consulting and advising on the connection between physical and mental health, how mental health affects the body. Dr. Abiola, can mental health conditions cause real physical pain even when no injury exists?
Oh yeah, definitely. Anxiety and depression lower the brain's tolerance for pain. So any pain you experience while you're under those conditions is amplified, even if there's no injury.
Okay. All right, doctor, let's take this call here. Hello, good morning.
Sure.
Hello, good morning.
Good morning. What's your name and where are you calling from?
Mrs. Oboli, calling from Ikovita.
Okay, I'm finding it very difficult to hear your name clearly. Could you speak up, please?
Mrs. Oboli, OBOL.
Okay, Mrs. Oboli, glad to have you join us.
Good morning to you and the good doctor.
Good morning.
Good morning.
Thank you for the discourse you're having this morning. So I've always tried to reach on air whenever you come on your programs, but thank God you picked your calls today. God bless you. So we're talking about physical and emotional stress this morning, I presume.
Yes.
So first of all, I want to say thank you to the doctor, because I really don't know what I know that I'm going through presently. So I'm a mother to a boy with cerebral palsy. He's 14 years old.
Okay.
Not only is it mentally or emotionally draining, but then it's everything draining. The doctor can understand that angle. So I took him to school last week, Friday, and I incurred an accident on the way. So although I dropped him in school, coming back home, I had an accident with a bike, and I'm always thinking every day that when I get out of this, how would I be able to cope going forward? So it hasn't really been easy. So I just started listening to your station sometime 2 weeks ago. But when I call, my calls don't get picked. So I want to say thank you for picking my call today. Thank you for sharing this discourse today. Not only is it therapeutic for people like me, but I'm learning. I would say it hasn't been easy. You clamor for women to speak up whenever you're on air, on the Panorama and every other of your programs. But please try to pick our calls, because when we share our stories, it helps to allay our fears, our worries, and makes everything disappear. So thank you very much.
All right. Thank you so much, Mrs. Oboli, for calling, and we're really sorry about your experience. It's a sad one, but I do hope that you recover soonest.
Thank you very much.
Thank you. All right, don't forget that it is Radio Doctor on your Women Radio 91.7, Nigeria's first and only radio station for women and their families, and our phone lines are very much open, so you get to call in 07000 917 917, 09155 917 917, toll free number 0800 1235 917, and then our text and WhatsApp line 08155 917 917, 0703 175 6537. We'll be picking all of your calls on the program, okay? And we have with us Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital. He's consulting and advising on the connection between physical and mental health, how mental health affects the body. Now, Dr. Abiola, I want to ask this question, and I am asking because it's something that Mrs. Oboli highlighted. So there's a conversation.
What did she say her son? What did she say happened to her son? I didn't hear that.
Okay, she said she was actually involved in an accident, and also she's been thinking. It's she has to take care of her son. So it's a whole lot, and she's been thinking and trying to also recover from the accident as well.
Okay.
Yeah. So I want to speak to a part of what she raised, and that is the part of thinking. So I remember when I was much younger, my dad would tell me, "Oh, Miracle, are you thinking? What are you thinking about? Don't overthink yourself." Now, at what point do you know that you are overthinking, that it could actually lead to a mental illness?
It's a great question. There's a term that I use called rumination, where and rumination is something that cows do. Cows have 4 stomachs, and when they're eating grass or whatever they're eating, they digest these things over and over and over and over and over again before it comes out. And that's kind of what happens with some of these thoughts. They're going. You're thinking about the same thing over and over and over again. When it increases your blood pressure, or gives you chest pain, or you feel feelings of anxiety, or we've said it can lower your immune system, it'd be hard to fight off infections, then it's an issue. It's a serious issue, and you have to find a way to break that cycle. Of course, if you can seek professional help, that's the ideal thing. But you can also do a lot of this on your own. Like I mentioned before, starting with the breathing, learning meditation. There's some apps, and maybe
Sorry.
people follow on social. I'll link some of these apps. There's some apps where even just 3 minutes of listening to a particular tone at, like, I listen to something called 528 hertz or another tone at 432 hertz. These things can actually break cycles and can also help reduce your stress and anxiety levels.
Okay. Thank you very much, Dr. Abiola. Don't forget, it's still Radio Doctor on your Women Radio 91.7, Nigeria's first and only radio station for women and their families. I am Miracle Philip, and I have with me Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital. He is consulting and advising on the connection between physical and mental health, how mental health affects the body. So if you've not been taking care of your mental health, you might want to begin to pay attention to it right now, because that could actually offer a strain on your physical body. So you might just be wondering, oh, why am I having to deal with this and deal with that? Just because you didn't take care of your mental health. And that's why we're dissecting it together, sort of an awareness with Dr. Abiola Ajayi. Doctor, I want to pick on the aspect of digestion. How does stress affect digestion, and why do some people experience stomach ulcers or constipation when they're anxious?
Your digestive tract, or the gut, so to speak, is sometimes called the second brain, truth be told. And stress can shut down digestion. It can also cause acid reflux, cause constipation. It can cause diarrhea, and of course, it can cause ulcers. There was a study done in Nigeria with college or university students, and they frequently report stomach issues when, especially when they're doing exams, right? So it directly affects your gut. I have been stressed extremely for the last 1 week, and you're hearing the physical ramification. That's where my voice is disappearing. So I've been running back and forth 3-hour drives almost every day. So I'm living what we're talking about. What a lot of people don't know, and I just recently learned a few years ago, is that serotonin, which is the hormone that regulates depression and your mood and your sleep, 90% of it is made in your gut, in your digestive tract. So if you're not taking care of your gut, there's no way you can take care of your brain and your mood. The two are directly linked.
Okay, thank you very much, doctor. And is it a possibility that one loses appetite as well when they're stressed, and that affects digestion as well?
Definitely, because not only that cortisol hormone gets secreted during stress, but another hormone called adrenaline, or some people call it epinephrine, same thing. It can cause you to lose appetite for however long. Yeah.
Okay. Now, doctor, I want to look at physical signs that anyone should look out for that may indicate an underlying mental health issue.
Yeah, some of the physical signs. Let's start with stomach pain. We talked about the gut, right? So we can have stomach pain. Another one I see often in the clinic is chronic fatigue. I'm tired all the time. That's why I hear that all the time. Then chest pain. You can have poor sleep or irregular sleep, and of course we mentioned headaches earlier, and then you can also have weight loss. It's because it's decreased your appetite, like we just mentioned, and people can also have weight gain because some people eat when they're stressed to try and calm themselves down, and I've even seen rashes, on the skin. So there are many physical signs that can be attributed to a health issue or a mental health issue.
Okay.
And what happens when these people go and see doctors that are not, or health professionals that are not trained properly, they make them feel like these are imagined symptoms, and I've seen that before, and it's without asking questions around stress, anxiety, depression, you're not really doing your patient service, a complete service.
All right, thank you very much, doctor. So I've got this message here from Mrs. Oboli. She's texting and she says, good morning. I said I have a 14-year-old son living with cerebral palsy condition that I was taking to school last week and got involved in an accident on my way home. So she just wants you to lend your voice to how emotional stress affects mothers tending to children with special needs.
Yeah, so now I get it. Cerebral palsy is, without going too deep into it, it's a medical condition, but the child or the person going through it is going to have chronic bouts of infection. They're always going to be sick or in need. And when you say special needs, these kind of people need a lot of attention. So that is stressful. It's not the average 14-year-old that can sit in the corner and play with the iPad or play video games. Sometimes you're going to have to give constant attention. So that stress could have led to her accident because now your hormone levels have changed. You're not. Remember, we talked about these hormone levels affect your memory. They affect your concentration. So you can be under that stress and not be thinking clearly. That's the better way of saying it. So we don't have a cure for cerebral palsy, but we can try and cure stress. And so I would recommend that she's engaging in some of these stress reducing exercises, breathing, yoga if you want, meditation. I promise you they work. Meditation is probably one of the besides the Lord, is probably one of the biggest reasons why I still in Nigeria and I stayed. Without meditation, I would have been so frustrated in this place. I would have left years ago. So it's really made a difference in my life, and it could make a difference in yours.
All right. So, Mrs. Oboli, I hope that you've gotten, clear answers to your question this morning. Thank you for reaching back. Dr. Abiola, there is the issue of poor sleep. So I've had to talk about how older people can have better sleep, but then there is the cause to that, which could be anxiety or depression. So how does this really impact on physical health over time?
Meaning poor sleep, right? Poor sleep increases your risk of high blood pressure, increases your weight, at least a weight gain. Poor sleep can even increase your risk of diabetes and stroke. So it's one of the most overlooked dangers of anxiety. If your mind doesn't rest, your body won't heal. I'll say it one more time. If your mind doesn't rest, your body won't heal. When you're sleeping, that's when your immune system is repairing damage that has occurred during the day. That's also where new memories are formed. So if you're having that poor sleep, you can have so many other just from the poor sleep, you can have so many other symptoms. Anxiety, depression are at the beginning.
All right. Thank you very much, Dr. Abiola. If you've just tuned in, this is Radio Doctor on Your Women Radio 91.7, Nigeria's first and only radio station for women and their families. And it's Radio Doctor, Nigeria's first specialized health program where medical doctors consult for free and advice on Your Women Radio. And it's broadcast 10 a.m. Mondays through to Fridays. So our Radio Doctor today is Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. Are you listening and have a question lingering in your mind? Please don't keep that question to yourself. The phone lines are open: 07000 917 917. 09155 917 917. Now, if you are a woman, we have a free line for you. It's a toll-free number, so you get to reach us on that line, 0800 1235 917. And if you'd like to just send a text message or a WhatsApp message, it's 08155 917 917. 0703 175 6537. Please don't call the text line, just send a message, and that will be it. Okay, so we're still having this conversation this morning, and we're dissecting with Dr. Abiola the connection between physical and mental health, how mental health affects the body. Now, doctor, are there links between mental health conditions and weight gain or loss? I know you said this earlier, but I'd like for you to expand on it a lot more.
Yes. The answer, short answer is yes. Depression may kill your appetite. So these people will lose weight, obviously, but it can also lead to emotional overeating, and that's the one I would probably say I see more in in clinical practice, which is emotional overeating. So, there are a large group of people that feel good when they're eating. For example, when my mom cooks when I go home, my mom cooks my favorite dish. I literally start dancing in the kitchen when I'm smelling like ooh, and that dancing is changing my hormones, making me happy. So the opposite is also true. If you're depressed, you may want to eat to try and get that feeling back, and then people under chronic stress will overeat and keep eating. Then on top of it, if you're using medication for anxiety or depression, some of those medications can also trigger overeating too. So it's a complex link, but it's a very real link.
So we've got this message here. It's from Divine from Magboro in Ogun State. Says, my mom complains about her legs sometimes biting her, and she does not feel her legs. This is as a result of stress. What kind of medication does she need to take, doctor? And that's a question from Divine.
Yeah, so before jumping into medication, we're not going to prescribe drugs on the radio here, so he should call. But somebody cannot feel their legs. I want to check this person for diabetes first of all, because that you can. It's something called diabetic neuropathy, where you lose feeling, and it usually starts from the bottom and works its way up. So I would want to do a comprehensive health check first, and then if all of those things are normal and we do find out that it's stress, then not only do we do some of these exercises I talked about, the breathing, yoga, meditation, but there is medication to help. There's a syndrome called restless leg syndrome, and it's tied where, especially when you're sleeping, you just can't control your leg. You're kicking or you're moving or they're tingling or that restless leg syndrome has been shown to be tied to your mental state, whether it's depression or anxiety. So it's a very real link too.
Wow, that's very, very interesting. I mean, well, doctor, I want to repaint that the last part of your thought on that. You mean when someone wants to sleep and they're just shaking their leg often, or in between sleep they are shaking their legs, then maybe they have a mental issue? Is that what you're trying to say?
That term, restless leg syndrome, it exactly happens. Sometimes it happens when you're already sleeping. Sometimes it happens when you're trying to fall asleep, or you're passing through the different stages of sleep, and it's very real. I have patients right now as I'm talking to you that I'm treating for that, so it's very real.
Wow, that's interesting. So if you're out there and you know that this is something you can relate to, it's something that you should pay attention to. Okay, so we're still here right here on Radio Doctor. Please don't forget the phone lines are open. 07000 917 917 or 9155 917 917. Our toll-free number for women 0800 1235 917, and our text and WhatsApp line 08155 917 917 or 703 175 6537. Those are the lines for you to get to call us on this morning. If you do have any questions for Dr. Abiola while on the program. Dr. Abiola, can mental health disorders worsen physical conditions like diabetes or asthma?
Yeah, they definitely. Stress makes asthma worse because remember we talked about stress leading to inflammation, and asthma is that inflammation of your airways, meaning that the tubes that carry oxygen from your nose or your mouth to your lungs will lose. They will grow in the inner portion. I'm trying not to use medical terms. They'll grow in the inner portion and actually narrow the airway, so less air will be entering your lungs. And what's interesting is that is now a cycle, because when you're struggling to breathe and you're not getting air in, it's going to even increase your anxiety levels. So stress can definitely make asthma worse. Depression can make diabetes worse by spiking your blood sugars, and it also lowers the effectiveness of medication. So in Nigeria, I've seen diabetic patients in crisis because they were battling undiagnosed depression. I have seen cases of it. It's rather common, but underdiagnosed.
Okay. And Dr. while you were talking, it popped up to talk about this. Sometimes people water down their experiences, the effect or consequences of their experiences, especially when it does not have a physical pain in itself. I'm talking about trauma. So sometimes people feel like, oh, it's really nothing. You went through a painful situation and you're not paying attention to how it has impacted on you in your mental state. So trauma from past abuse or grief physically, how does it manifest in the body?
A lot of people do this subconsciously, where you undergo a stress or an issue, sometimes a sexual assault or an abuse or physical abuse, and to protect your brain, to protect itself, will try and shove those memories down. So I see that all the time. Well, remind me the question you were asking again.
Yeah, I was asking about how trauma manifests in the body. Trauma from past abuse or grief.
Exactly. So your brain trying to protect yourself from rumination, meaning you're constantly thinking about that abuse or whatever stress happened to you. It will try and suppress it, the memory, but this will still trigger those hormone responses. So your cortisol goes up, it stays up, your blood sugar is affected, could lead to diabetes. But on top of that, you can also have the chest pain, the difficulty breathing, the poor sleep, and all of us know what happens to us when you don't sleep very well for a day or two. It just ruins everything afterwards. So imagine now having this trauma that suppressed. You may not sleep well for a year, and this is definitely going to affect so many different things in your life. If it's a college age or university age person, they're going to have difficulty concentrating on their studies, and they're also going to have difficulty retaining information because of the cycle that we described earlier.
All right, thank you very much, Doctor, for sharing this with us. So, if anybody is having to deal with trauma, I know sometimes people are not aware that they are really dealing with trauma. So, what should they look out for? What signs should they look out for to let them know that, apart from the fact that you went through the abuse, you went through the grief, is translating to something that can affect your mental health? But just before you respond, let me take this call. Hello, good morning.
Hello, good morning, ma'am.
Good morning. What's your name?
Sir.
Good morning. What's your name and where you calling from?
It's Mr. Motosho from Akuti.
You're welcome. You're welcome, Mr. Motosho. Oh my, we missed a call. You can do well to call us back, Mr. Omotosho. Okay, we'll take your call. All right, doctor.
Yeah, so trauma lives in the body, not just the mind. So you can have chronic pain, chronic fatigue, meaning tired all the time, even heart palpitations, and like we mentioned before, digestive problems. These are all very common in survivors of abuse or those carrying deep grief. You're just grieving. So trauma also rewires your nervous system, rewires your brain to always be on edge. So you have these traumatic experiences. You may think that they're buried, but really like I said before, the trauma lives in the body. So your nervous system always on edge. You're going to have more anxiety, even more depression. Anxiety and depression are linked together, and other physical signs like the palpitations, chest pain, chest tightness, and so forth.
Okay, thank you very much, doctor. Okay, let's take this call. Hello, good morning.
Hey, I'm back. Good morning. I'm not also Lukman.
Okay, welcome back.
My question is this. I have a girl who is having problem with sleeplessness.
Okay.
So the drugs were recommended for him, and this drug doesn't really work, for it to induce his sleep. But is there any way exercise can work for somebody who is not well?
Okay, that's your question. All right, thank you very much, Mr. Motosho, for calling. Doctor, you got that question?
I think he said he has somebody dealing with poor sleep.
Yes.
Right.
And he's been given some, medications, but he doesn't think it's working, and he wants to know, can exercise help?
Oh, okay. I didn't hear that part. So the answer is yes, definitely. Exercise is not just will improve your muscles but it also changes your hormone levels. So exercise can increase the happy hormone. Let me just call it that, happy hormones, and those hormones are directly tied to sleep. So those that undergo regular exercise, almost all of them report improved sleep. And you also have to be careful. Some of these drugs that are prescribed for sleep are habit forming or addicting. So when you use them, maybe you fall asleep. Most patients tell me they fall asleep for a few hours, then they will wake up and they can't go back to sleep. But when you now withdraw the medication, if you use it for a while and now stop it, you get something called a rebound effect. So things get worse than they were before. Now you definitely can't sleep, and now you definitely feel anxious all the time. So exercise is a great therapy, and if you can combine that with your breathing and your meditation, you've now done a great service. Usually when I have somebody complaining of chronic insomnia or difficulty sleeping, I will ask questions about lifestyle, depression, and anxiety, and I will usually start with supplements rather than drugs that just force you to sleep. And these can sometimes magnesium deficiency will affect your sleep.
Okay.
So and I'll give magnesium. There's a supplement. There's a hormone in your body, melatonin. If you don't have good melatonin, you're not going to have good sleep. So I'll start with that. Try that for 2 weeks before even considering some of these addicting or more harmful medications.
All right, thank you very much, doctor. If you've just tuned in, this is still Radio Doctor on your Women Radio 91.7. Mr. Omotosho, I do hope that you've gotten the answer to your question this morning. So you try to incorporate that for your brother. Don't forget that the phone lines are still open. 07000 917 917, 09155 917 917. Our toll-free number for women, 0800 1235 917, and our text and WhatsApp line 08155 917 917, 0703 175 6537. Don't forget that you can actually drop a text message or a WhatsApp message this morning, as Dr. Abiola Ajayi is right here to answer all of your questions. We're discussing the connection between physical and mental health, how mental health affects the body. All right, doctor, why do some patients with mental health struggles visit hospitals often with unexplained symptoms?
Yeah, the simple answer is because emotional distress can show up in physical form. They're not faking it. I take any of these complaints seriously, but I would venture to say the majority of classically trained medical professionals will not, and they will say you're faking it, right? But they're not faking it. They're hurting, and unless doctors screen for mental health, they'll keep treating symptoms instead of the root cause. And I've mentioned that I practice something called integrative medicine, where you're trying to find the root cause, not just knee-jerk prescribed medication. I use medication all the time, but trying to identify the root cause is important. And a large part of that is screening for mental health. Simple questions like, do you feel depressed or have depressed mood more often than not? Do you ever have palpitations? Do you ever feel anxious? Is there anything going on that's in your life or with your spouse or with your girlfriend that is stressing you out? You have to ask those questions to be able to treat the root cause and treat the whole patient.
All right, thank you very much, doctor. Doctor, I also would like to know, and for anyone out there, can treating a person's mental health condition also reduce their dependence on medications for pain or high blood pressure?
Yes, very, very much so, because stress, depression, anxiety, all those conditions increase your blood pressure. So if you're able to treat that, it goes in the opposite direction and reduces. So it's very true link. Very, very true.
Okay, and we have this question here. It says, what role does music play in stress reduction?
That's a very interesting question. So there are many studies. There are multiple studies that have been done with music. For example, and different types of music. So they'll either use classical music, like Mozart, Beethoven, and then now hard rock music, guitars and drums banging. And in fact, the CIA uses music as a torture device. So they can play loud, non-harmonious, disruptive music over speakers for 1 day, 2 days, 3 days. By that fourth day or however long, the person is ready to break. It's mentally taxing. It promotes anxiety, as opposed to if they played classical music, or soft jazz during that time, which will soothe and relax you. They've even done the same studies with plants. So you put 50 plants on this side of the warehouse and 50 plants on the other side, and one side you play nice, smooth, relaxing music, and the other side you play this, hard rock is the one that I always think about. And the plants that are getting the softer classical music grow longer and higher than the other ones every time. Every time. So it is linked, and that field is called epigenetics, and it's something I'm really interested in. I've been studying for a while.
Wow. Well, thank you so much, Doctor, for answering to this question. I'm sure now a lot of people will pay attention to the kind of songs and music that they listen to. Okay, so just as we wrap up, Dr. Abiola, what practical steps can people take to protect their physical health from the effects of mental stress in 2 minutes?
Okay, in 2 minutes, you have to pay attention to your sleep. Sleep well. Sleep is called sleep hygiene. Making sure that your sleep. You cannot bank sleep, so you can't sleep for 10 hours today and think that it carries over to tomorrow. You need to practice sleep hygiene every day. Eating nourishing food. Oh, sorry. Go ahead.
Yeah, I just got this message and I thought to interrupt. This is Victoria from Alakwere. She says, Good afternoon, good morning, actually. I've been going through a lot currently. Anytime I'm hurt or crying or I'm angry, I do have this chest pain. I find it difficult to breathe. Please, sir, what can I do to stop it?
So see, she's basically describing what we've been talking about for the last hour. You know, when you have that anxiety, it causes inflammation. Your muscles actually tighten in your chest. The blood vessels constrict or get smaller. Your airways get smaller, and you're going to find it difficult to breathe. If in this kind of patient, I would talk to her about depression, anxiety, life, what's going on, and see can we incorporate some of these stress-reducing activities that we mentioned. And if she finds it difficult to breathe, I would have a rescue inhaler in my pocket so that you can push those airways open right away. Well, by the time you take 2 puffs of that rescue inhaler, within two minutes, you're going to feel much better and be able to breathe. And over time, we can now manage the stress. You'll now need that kind of thing less. But nobody should struggle to breathe, and nobody should have untreated anxiety. It just keeps going in circles. So you have anxiety, struggling to breathe, keeps getting worse, and it can cause you to have to get to the hospital. And like we said before, can mimic the signs of a heart attack even.
Okay, doctor. Well, we really do short on time, but I really want to say thank you so much for today's free consultation and advice on the connection between physical and mental health, how mental health affects the body. Thank you so much, Dr. Abiola.
My pleasure. Kudos to WFM for treating this topic, and I'll see you next week.
Oh, it's a pleasure. Well, that is Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital, who was in for this free consultation and advice. Now, if you do need a consultation, you might want to grab a pen and a paper to get this one, because you can actually reach Dr. Abiola Ajayi on 0913 579 5108 0913 579 5108, or you could also reach out to 0816 601 4901 0816 601 4901 for an appointment or directions. Thank you so much for listening on Radio Doctor today. You can also reach Dr. Abiola on Facebook, on Instagram, ROA Specialist Hospital, YouTube ROA Hospital, Twitter, that X now, ROA Hospital as well. Well, we'll be back next week, but coming up next is Talkam As You See. I'm a program where you can share anything that is on your mind. I am Miracle Philip.